Hello everyone, welcome to AY Tutorials. Today we are going to study antidiuretics. So let's get started. Do you know how antidiuretic hormone is secreted? So ADH, that is antidiuretic hormone, is also known as vasopressin, and it is produced in the hypothalamus, which is the part of brain, and stored in the posterior pituitary gland and its vesicles, and released into the bloodstream when it's needed. Here is the classification of antidiuretics. There are three main classes of antidiuretics. First one is antidiuretic hormone and its analogues. For example, vasopressin, that is ADH, then desmopressin, lipressin and terlipressin. Then second one is natriuretics, in that thiazides and amiloride comes. And third class is miscellaneous. For example, carbamazepine, chlorpropamide and indomethacin. Introduction to the diuretics. So what is the definition of diuretics? Drugs that reduces the excretion of urine. Then physiological basis, the role of diuretic hormone in water balance. So antidiuretics, they are very important to have a water balances in the body. Then clinical importance, antidiuretics are used in the treatment of diabetes insipidus and other conditions. What is diabetes insipidus? So it is characterized by excessive thirst and urination, that is polyuria, which is caused by the kidney's inability to properly reabsorb the water, which leads to a large volume of dilute urine, and so it is treated condition in as in antidiuretics. Vasopressin and its analogues. Mechanism of action. On V1 receptors, it shows vasoconstriction. V1 receptors primarily known for vasoconstriction, which can indirectly contribute to the antidiuresis by affecting renal sodium reabsorption and blood pressure, which can influence water balance. And on V2 receptor, they increases water permeability in the collecting ducts. So the vasopressin V2 receptor, they mediate the antidiuresis by stimulating water reabsorption in the kidney by increasing water permeability of the connecting duct. Examples include vasopressin, desmopressin and terlipressin. Pharmacokinetics. Routes of administration. Vasopressin can be administered by intravenously and on intranasal route and oral route. Onset and duration of action. The onset of the pressor effect of vasopressin is rapid and the peak effect occurs within 15 minutes, and after stopping the infusion the pressor effect fades within 20 minutes. Then therapeutic uses. Central diabetes insipidus, nocturnal enuresis, in that desmopressin is used. Nocturnal enuresis is bedwetting. Then hemophilia A and von Willebrand disease, in that desmopressin is used. Von Willebrand disease means an inherited blood disorder that prevents the blood from clotting properly. Then esophageal variceal bleeding, in that terlipressin is used, and there are some adverse effects also, which includes water intoxication, hypertension, headache and abdominal cramps. Desmopressin, it is selective V2 receptor agonist. It is having the long duration of action than vasopressin, and desmopressin is preferred drug for central diabetes insipidus and nocturnal enuresis. Drugs that enhance the antidiuretic hormone action. Mechanism of action. The increased sensitivity of renal tubules to the antidiuretic hormone. Examples includes chlorpropamide, carbamazepine and chlorfibrate. Then therapeutic uses used in central diabetes insipidus in some cases, and adverse effect includes hyponatremia and some drug interactions also there. Clinical applications of antidiuretics. They are used for the diagnosis and treatment of central diabetes insipidus, then in treatment of nocturnal enuresis, hemophilia A and von Willebrand disease, also esophageal variceal bleeding. Diabetes insipidus, central versus nephrogenic. They both are having differential diagnosis. Then in central, deficiency of ADH is there, that is antidiuretic hormone, and in case of nephrogenic, renal resistance to the ADH is there. They both are having differences in treatments also. Adverse effects and precautions. In case of water intoxication, it should be given by taking some precautions. Then monitoring fluid balance and electrolytes is necessary. Then there are certain drug interactions also which should be taken into consideration, and precautions should be taken in patients with the cardiovascular diseases. Drug interactions. Drugs affecting antidiuretic hormone release or action, and it is having the interactions with diuretics. Here we have concluded the topic of antidiuretics. If you guys are having any query, you can drop it in the chat box. And if you like this video, you can like, share and subscribe to the AY tutorials. Thank you.